shift to remote learning for many students across the tri-state comes with a huge increase in screen time for children. For years, doctors have recommended limiting screen time, but now they're trying to figure out what kind of impact it is having on kids since it's not always possible to unplug.
Our Josh Bazan talks to Cincinnati Children's Hospital Medical Center about what parents need to know.
And screens have become such a huge part of kids' lives in a very short period of time that we really don't know a lot of the longer term effects.
It was a huge change that happened almost overnight, and even 9 months into the coronavirus pandemic, many schools are still in remote learning as they finish up the fall semester.
Across the board, it's a big deal.
The American Academy of Child and Adolescent Psychiatry says too much screen time can lead to sleep problems, mood problems, lower grades, and other issues for children.
I think for all children there's a concern. We definitely know that it's, there is a correlation between more screen use and the potential for negative outcomes, whether again it's physical health, mental health, or social.
Cincinnati Children's pediatrician Dr. John Hutton closely follows the impacts of screen time on children and says it was a growing concern well before the coronavirus pandemic. And now, with so many schools and families in remote learning and kids on screens longer hours at a time, Dr. Hutton says it is important for families to set limits on screen time outside of lessons.
I think it's very important. I think that every family is going to have something that's realistic for them. I think, there's definitely not a one size fits all.
Dr. Hutton says his biggest concerns during this screen time shift are with children from 0 to 5 who are still trying to figure out how the world around them works, and adolescents going through rapid social development. For those kids, a screen just can't replace in-person interactions.
There also, I think, are particular ages where children are going to be probably more sensitive to excessive screen use.
Dr. Hutton says schools and teachers have done a good job getting creative with virtual lessons to give kids a break from screens during the day, and he points out educational screen time should be looked at differently than leisure screen time. At Cincinnati Children's, Josh Bazan, WCPO 9 News.